How to understand your thyroid scan results. Understanding your thyroid scan results can feel overwhelming, but breaking it down can help. A thyroid scan is an imaging test that looks at how your thyroid gland is functioning. It uses a small amount of radioactive material, called a radiotracer, to evaluate the structure and function of the gland. The results show how much of the radiotracer is taken up by the thyroid tissue, which helps in diagnosing various thyroid conditions. First, let's look at the purpose of the scan. It helps assess thyroid function, identify the causes of abnormal hormone levels, evaluate nodules, and even detect thyroid tissue that is not in the usual place. This information can guide treatment decisions, including whether radioactive iodine therapy is needed. Next, understanding the radiotracer uptake patterns is crucial. A normal scan shows a symmetrical thyroid with uniform uptake of the radiotracer. Typically, the uptake percentage is between 10 to 30% 24 hours after the radiotracer is administered. This normal uptake indicates that the thyroid is functioning properly. If you see hot nodules on your scan, these areas show increased uptake. This means the nodules are producing thyroid hormones on their own, which is usually a benign condition. On the other hand, cold nodules show decreased or no uptake. These nodules do not take up the radiotracer well and may indicate non-functioning tissue. Cold nodules have a higher risk of being cancerous and often requiring further evaluation, such as a fine needle aspiration biopsy. The scan also provides information about the size and shape of your thyroid gland. If the gland is enlarged, this condition is called a goiter. A diffuse enlargement with uniform uptake might indicate Graves' disease, which is an autoimmune form of hyperthyroidism. If the enlargement is nodular with uneven uptake, it may suggest the presence of nodules or cysts. When interpreting your scan results, your healthcare provider will also look at your blood tests, which measure thyroid-stimulating hormone and thyroid hormone levels. For example, a low thyroid-stimulating hormone level with a hot nodule suggests that the nodule is producing excess hormones, leading to hyperthyroidism. Conversely, a normal or high thyroid-stimulating hormone level with a cold nodule requires careful assessment for potential malignancy. Additionally, the scan may reveal ectopic thyroid tissue, which is thyroid tissue located outside its normal area, or show uptake in areas outside the thyroid. These findings can significantly influence your diagnosis and treatment plan. It's important to remember that a thyroid scan alone does not diagnose cancer. It helps assess risk. Cold nodules often need further evaluation through ultrasound and biopsy. Also, pregnant or breastfeeding women should avoid this scan due to radiation exposure. In summary, understanding your thyroid scan results involves recognizing the functioning of your thyroid and any nodules based on radiotracer uptake patterns. Assessing the size and shape of the gland and correlating these findings with clinical data is essential. Always consult with your healthcare provider to understand the significance of your specific results and to discuss any further testing or treatment options.